Now we're going to talk about spreading bacteria and how this affects you and the ones that you love. Since the 1970s, we have known that cavity bacteria transfer from person to person through kissing and sharing food. Mothers traditionally infect their babies, and spouses share the same strains of germs. Even children at daycare will transfer the disease. In early studies, xylitol was given to pregnant mothers so they could clean their mouths before their babies were born. The results were amazing and showed that these children grew up with 80% less cavities than the control groups. So why? Tell me why, 40 years later, most people do not know this. Your toothbrush can also be a source of infection, transferring plaque germs from others who share the same brushing area with you. Toilet areas are a nightmare for bacteria sprayed in a plume each time you flush your toilet. Anyone with gum disease should consider a better way to clean their toothbrush every day and preferably move it away from any toilet area, maybe into the kitchen. It's not possible to control cavities by flossing with fluoride, or even by visiting your dentist every 6 months. Evidence-based studies show that brushing only removes about 30% of plaque, and there is not one randomized clinical trial to show that flossing stops cavities. Not one. The fact is that brushing and flossing does not deal with cavity bacteria, since they float in saliva and transfer from person to person. The great news is that there is an easy way to control these cavity critters. Small amounts of xylitol eradicate cavity-producing Streptococcus mutans, and it takes about 6 months. It's important to have enough xylitol each day, at least 5 grams, and also important to check the labels and avoid xylitol that's mixed with sorbitol or artificial sweeteners. You even need to check xylitol crystals, because sometimes the cheaper brands mix xylitol with sand or other cheaper sweeteners. One brand even mixes precious xylitol with the horrific artificial sweetener Splenda. In a few weeks of using xylitol, plaque will slide off your teeth. Then xylitol will start to clean the rest of your mouth, tongue, and finally your saliva. Now you'll have clean saliva and no longer be a source of infection to those you love. The best news is that this will happen quickly, and almost all plaque bacteria will have gone in 6 months, even without flossing.